John, with pharmacists seeing such a big percentage of the allergic rhinitis patients, when would you expect your pharmacy colleagues to refer to a GP?
Right, okay. Well, I think Richard's alluded to this in his 2-week program. I think if you've considered the symptoms, you've chosen some treatment options, I think ideally you will have included intranasal corticosteroid in those. But if after 2 weeks there's no improvement, then you definitely should be referring on to the GP. You'd be asking your customer to come back and let you know how they're going. I would say in a week, but maybe you'd give the treatment a couple of weeks. Beyond that, you're referring to the GP, definitely.
Okay, and then when they came to us at 2 weeks, we'd obviously be thinking, is there an intercurrent upper respiratory tract infection, or are they in the quarter of people with a non-allergic type nasal inflammation? Then the thinking, Richard, is there a group, do you feel that there are a group who are missing out on being referred on to specialists, or do you feel that your referral base is fairly appropriate?
I think GPs do a great job really of picking out patients, but if you said to me, you know, what's a guide? Guides, I think, is that if you don't respond to intranasal corticosteroid within 2 weeks, you need to reconsider the diagnosis. I think if the patient has lost their smell, we touched on this, that's not a typical symptom of allergy. Unilateral symptoms should be looked upon. And even I would say rhinitis-only symptoms. So someone who doesn't seem to have any other features of allergy, they don't have conjunctival symptoms, lung symptoms, skin symptoms, only have nose. And especially if they're slightly older when their symptoms came on, especially in their 50s and 60s, you know, it's very likely it may be another cause for their nasal symptoms rather than allergic rhinitis.